Hip impingement, or so-called femoroacetabular impingement, is a problem that, if left untreated, could lead to early osteoarthritis. Hip impingement is actually the mechanism that may lead to early cartilage damage, and it's defined as a lack of hip clearance from the socket with range of motion. Many young patients may suffer from hip impingement, and that usually is manifested as pain in the groin with activities of daily living or after sporting activities. Many patients complain of stiffness as well as pain that subsides when they're not active. These patients are usually diagnosed with a clinical exam, and then we use ancillary testing such as x-rays to evaluate for the structural deformity. If you are diagnosed with hip impingement, the initial treatment is non-operative, and there are several options for non-operative treatment. They include the use of anti-inflammatory medications, joint injections, physical therapy, and a limitation in your activities of daily living, especially those that cause the problem. That being said, we have found that non-operative treatment is not always successful, and therefore many of our patients require surgical intervention. There are multiple options for surgical intervention, some that are less invasive and others that are more invasive, and the choice of surgical intervention will depend on how bad of a structural problem you have and how bad the cartilage and the labral damage is present. In many cases, we can still do a hip arthroscopy in which a camera and a shaver are put into your hip joint, and the labrum and cartilage can be trimmed or repaired as necessary, and then the bony abnormality can be shaved off your femoral as well as socket bones. If less invasive surgery such as hip arthroscopy is not the best option for your hip, then there are two major open surgical procedures that we currently do. One of the advantages here at the Mayo Clinic is we can treat the patient with multiple types of operations, and therefore we have both the hip arthroscopy as well as the open surgery that can be offered for your hip. A surgical hip dislocation is a hip procedure in which the hip is taken out of the socket and the bony rim is trimmed on the acetabular side or femur. But if you are not a candidate for that operation, occasionally we would have to do a periacetabular osteotomy to correct the version of your acetabulum.